Psychology behind addiction. Addiction is a complex condition, a brain disorder that is manifested by compulsive substance use despite harmful consequences. People with addiction, severe substance use disorder, have an intense focus on using a certain substances, such as alcohol or drugs, to the point that it takes over their life. Here's a look at the psychological factors that contribute to this compulsion. Understanding addiction. Addiction involves a number of key phenomena. Craving for the object of addiction. Loss of control over its use. Persistent involvement with it despite adverse consequences. Psychological theories of addiction. 1. Reward and reinforcement. This theory suggests that substances or behaviors that are addictive provide a significant reward or pleasure, which reinforces the behavior and makes the person want to repeat it. Drugs, for example, can release 2 to 10 times the amount of dopamine that natural rewards do, and they do it more quickly and more reliably. 2. Cognitive theory. This approach focuses on how people with addiction perceive and think about their addiction-related behaviors and drug use. It might involve unrealistic thoughts about the benefits of substance use or minimizing the consequences associated with it. Cognitive behavioral therapy, which addresses these thought patterns, is often used as an effective treatment. 3. Conditioning. Both classical and operant conditioning play a role in addiction. Classical conditioning can make the substance or activity a powerful cue for the use. For example, seeing a bar might trigger the urge to drink, whereas operant conditioning can be seen in the reward context, the high feeling from drugs acting as a positive reinforcement. 4. Psychodynamic theory. This theory looks at how early life experiences, emotional trauma, and unresolved inner conflicts might lead to substance abuse as a way to manage pain or anxiety. According to this perspective, addiction can be seen as a self-medicating response to deep-seated emotional pain or psychological trauma. Biopsychosocial model. Addiction is best understood through the biopsychosocial model, which combines biological, psychological, and social factors. Biological factors may involve genetics and neurochemistry. Social factors might include family, relationships, socioeconomic status, and culture. Psychological factors encompass an individual's coping mechanism, emotional health, and personality traits. Stages of addiction. Addiction typically develops in stages. Experimentation. Use might start out of curiosity. Regular use. The individual may start using regularly without obvious negative consequences. Risky use/abuse. The use becomes more frequent, increasing the user's risk of harmful consequences. Dependence. The user becomes dependent on the substance to function daily and experiences withdrawal symptoms when not using it. Addiction. At this stage, seeking and consuming the drug becomes compulsive, despite the potentially devastating consequences. Treatment and recovery. Understanding the underlying psychological factors is key to effective treatment approaches, which may include therapy, medication, and community support. Treatment plans are often customized and can involve a combination of detoxification, behavioral counseling, medication, and long-term follow-up to prevent relapse. Recognizing the psychological underpinnings of addiction helps in treating it more effectively, acknowledging that recovery is not simply about stopping drug use, but about changing deeply rooted behaviors and addressing emotional and psychological needs.